Welcome back to Drugs Decode. In today's session, we're going to decode one of the most important classes of antibiotics, beta-lactam antibiotics. We'll explore their structure, mechanism of action, pharmacokinetics, clinical uses, adverse effects, and drug interactions. Let's dive in. Beta-lactam antibiotics are named after their core chemical structure, the beta-lactam ring. This ring plays a critical role in their antibacterial activity. These antibiotics target bacterial cell walls, which are essential for bacterial survival and integrity. Without a functional cell wall, bacteria can't survive, making beta-lactams effective bactericidal agents. Beta-lactam antibiotics are broadly classified into four groups. Penicillins, such as penicillin G and amoxicillin. Cephalosporins, with examples like ceftriaxone and cefuroxime. Carbapenems, such as meropenem and imipenem. Monobactams, like aztreonam. The bacterial cell wall contains peptidoglycan, a crucial component for structural integrity. To form the cell wall, bacteria rely on cross-linking of peptidoglycan strands, a process mediated by penicillin-binding proteins. Beta-lactam antibiotics bind to and inactivate penicillin-binding proteins, preventing the cross-linking of peptidoglycan. This disruption weakens the cell wall, causing bacterial lysis due to osmotic pressure. This mechanism is highly selective for bacterial cells, sparing human cells since we lack cell walls. Let's discuss how beta-lactams behave in the body. Many beta-lactams, like penicillin G and piperacillin, have poor oral absorption and are given parenterally. Drugs like ceftriaxone and meropenem can cross the blood-brain barrier, making them effective for treating meningitis. Beta-lactams are mostly not extensively metabolized. They're primarily excreted unchanged via the kidneys. However, some drugs, like nafacillin, oxacillin, and cefapyrazone, are excreted via bile, which can be important in cases of renal impairment. Beta-lactams are used for treating a wide range of infections, including skin infections like cellulitis, respiratory infections, including pneumonia, central nervous system infections like meningitis, sexually transmitted infections such as syphilis and gonorrhea, urinary tract infections and pelvic infections. They're also effective against Helicobacter pylori, a common cause of peptic ulcers. Although beta-lactams are generally well tolerated, they can cause adverse effects. Hypersensitivity reactions, ranging from mild rashes to severe anaphylaxis. Neurotoxicity, particularly with carbapenems in high doses. Gastrointestinal disturbances, including nausea and diarrhea. A disulfiram-like reaction with certain cephalosporins when combined with alcohol. Monitoring and patient counseling can minimize these risks. Lastly, beta-lactams interact with some drugs, including probenecid, which prolongs their half-life by inhibiting renal excretion. Aminoglycosides, which, when combined, can increase the risk of nephrotoxicity. Anticoagulants, which may increase bleeding risk, especially with certain cephalosporins. Understanding these interactions is critical for safe and effective. And that wraps up our discussion on beta-lactam antibiotics.
Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content about health and medicine.